It's a privilege to introduce our first speaker, Jennifer Stoddart. Not only does she come from McGill, yay, but she actually was the Privacy Commissioner of Canada for a decade, and I think probably in the history of the Privacy Commission of Canada, they've never seen such a phenomenon in terms of her expertise and her courage in that role. She's a member of the board of the International Association of Privacy Professionals. She's also a member of the board of Genome Quebec, and she co-chaired an OECD committee on healthcare governance, which she will talk about. She's an advocate emeritus of the Quebec Bar and an officer of the Order of Canada, so it's my pleasure to welcome Jennifer to speak to us about health data governance.
Hello, bonjour. Thank you very much, Bartha, and thank you all for inviting me to present in your program. And I hope I'm starting in the afternoon off after we've heard so much about the barriers to data sharing with some good news. And of course, we've heard and you know that the silo approach to data protection is not entirely defunct. Some argue that this is still reflected in the GDPR. This was a concern from the OECD. You all know about the OECD, Organization for Economic Cooperation and Development, made up of 30 countries, trying to improve the living standards of their members. And so, over the years, the OECD documented the various barriers to data sharing and decided to do something about it. The OECD had good building blocks. The OECD was the first international organization to create guidelines on data flows back in 1981. This preceded the European Directive and other similar initiatives. More recently, it's brought it up to date, and the OECD then made its own series of studies on health data governance, starting at about 2011. And so it found that there were many drivers of data use. None of this is new to you. I draw your attention to the new therapies and better research as an important reason for making maximum use of health data. This is another OECD slide. Most of these slides are the OECD's own slides made internally because I thought they would show you a little more effectively just how practical the OECD means to be in encouraging data linkage and better data governance. This is what I call the Inspector Murdock chart. Inspector Murdock, you might know him. He's a detective in early 20th century Toronto, about 1905. He has a girlfriend who's a doctor, and a lot of their discussions take place in the morgue. He also has some cases involving people in what was then called the insane asylum. So you see that between then and now, the areas where we have a lot of data are the traditional areas, and the areas which are of great concern today, such as diabetes, we have very little data use and linkage. These are some of the OECD studies on which it based its work. And so the OECD came to the realization, not alone in it, that data was essential for the economic progress of its countries and their populations. So by 2014, this problem of the lack of data sharing became urgent, and an approach was developed to try and reconcile the privacy and security guidelines of 1981 as they had developed and the need to share health data more widely. So a working group was set up, most unusual for a large organization. It crossed two sectors. One sector was privacy and security, the other sector was health, and you can see who was on it, some of the usual suspects, Dr. Bartha Knoppers, Dr. Mark Taylor, And I underlined David Smith, who was the Assistant Commissioner at the time of the Information Commissioner's Office of the UK, which is regarded as the world's premier regulatory authority. I'm excluding the Federal Trade Commission because it's a consumer protection office. So 3 years of work, all the OECD health ministers signed on to a recommendation on health data governance just at the beginning of this year. Two important messages in this recommendation. First of all OECD countries need a national health data governance framework. They have to think about this in an overall holistic, rational approach, not keep going along with a law here and a law there and some regulations and practices and so on that in fact impede data sharing. And secondly, they have to look beyond their own borders and adopt frameworks that harmonize with those of other countries. One of the interesting things about the OECD is, unlike some of our own national legislators, they don't just pass resolutions or guidelines and then leave it there. They actually work with their member countries to see that these are implemented. They develop kits, tools, try and help countries to actually put these into practice for the betterment of their citizens. So this is a list of measures, the 12 measures that are key to developing a health data framework. We'll come back. And they spell out the important mechanisms, and they put up front there's benefits, but there are also risks. These are some of the indicators that need to be monitored because from their previous studies, the OECD realized just how much resistance there is to data linkage and data sharing for various reasons. And so they really have gone out of their way, I think, in terms of this initiative, to give countries the tools, the approaches, here the indicators, so that the excuses that were extant up till now can no longer hold sway. They point out the many health data success stories. Because we're in the US, I'll point out that the US is seen as a success story because it follows up on medical technology post-market. The UK, of course, is seen as a leader in research and innovation with its biobank. And here you see all the OECD countries lined up in terms of who shares and makes data accessible. The UK seems to be the overall leader, and the rest of us trail somewhere behind. Again, each country of the OECD can find itself on this chart. How ready are you to use the rich trove of data in electronic health records? Some are very far behind. And again, the building blocks for countries for implementation and monitoring, you can see the OECD encourages countries to be practical, to be open, to share with NGOs on their territory, and of course, they have to monitor what they do and they have to report back to the OECD. So for each of the 12 elements for national health data governance frameworks, the OECD has gone out of its way to highlight the success stories. I hope you can see them. They're in blue, different countries. Again, the UK seems to come up the most frequently. The UK is a unitary country, so compared to some of us federated countries, things are slightly more easy, I would say, but nevertheless, they have been really world leaders in this area. You can see that the USA, again, because we're here, I think it's interesting, is cited out as a leading example of how to train in privacy and security. So any country can just, through this, look to another country, see what they're doing in that particular component of a health governance framework, and borrow from it. So nobody really has to reinvent the wheel in this area. This is what the recommendation formally looks like. This is an extract. Nobody's really interested in this except a few lawyers, so I've just highlighted two of the most important things. The paragraphs that deal with the recommendation for setting up a health data governance framework and the need for coordination within the country, both in the public and in the private sector. This is hugely important because we have a range of countries in the OECD. Nobody's healthcare system is held up for comparison to another overall. We know that we have to work with other public partners within a country, with private partners, more so in some countries than the other, but that they are all players in a health data governance framework. Second part that I would draw to your attention is the recommendation for international sharing and harmonization of frameworks. This is potentially revolutionary, as historically each health system has grown on its own within the context of its own culture, its own laws, it's the importance of its own various professions. And we're going a step further now. We're saying as you build up your health data governance framework, the rules that are part of it, the way it functions and so on, look across your borders. See how people in your country can benefit from the exchange of data among OECD members, but potentially across the globe. And so once again, the OECD is spelling out for its member countries what they have to do step by step in order to move towards harmonizing frameworks internationally. And again, it gives some examples. So here we see another illustration of the practical way in which the OECD works. You'll see by now that all our countries, probably most people here belong to a country that is a member of the OECD. We will have sent back their questionnaires. The OECD functions on questionnaires. You're always answering a questionnaire when you deal with the OECD. In January, they will they've just got the feedback on the implementation guide that they're working on, and it's in January they're going to send out another questionnaire. And as you go down this list, every 6 months, you will see there is a clear action, and the timetables are usually, and I've been working with the OECD since 2006, they're usually adhered to. It's very rare that the OECD accumulates big delays in its work. So you can expect to see this happen, and the end point is 2022, when it will go to the decisional instances of the OECD, and probably at that point, either the work will be continued or new variations of this work, given its importance, will emerge. So to conclude, I think, of course, I'm biased, having been involved in it, I admit, but I think that this is a major policy instrument. I think that you can use it in the Global Alliance within your own countries to say, well, look, our delegate to the OECD signed on to this. Our health minister was one of the ministers that agreed to this framework, this recommendation. And so what are we doing in moving forward to try and implement it? You can also look at the various toolkits and guides that the OECD has developed to point them out as reference helpers, aids within your national governments to move forward and to abandon some of the often very loved but very now outdated approaches to data governance. So this will move, of course, unevenly, but I think it is an authoritative document given the OECD's importance in terms of economic policy, social policy generally, and the research that bolsters this particular initiative. So thank you very much, and I welcome your questions.